I'm really, really thrilled, Sharon, that you've been able to spare the time to talk with us today on this topic of leading change in social care, both in the UK and overseas. I know that you're a long-term supporter and recipient of a Florence Nightingale Foundation scholarship. So it's always wonderful when our alumni come back to share information and their experiences with our current leadership programme participants, our scholars, our alumni, our members, so reaching a really wide network. So thank you ever so much. And just by introduction, for those of you that haven't had opportunity to connect with Sharon throughout her extensive and established career, Sharon has been making waves in the independent sector for many, many years, including being the Policy and Communication Director at National Care Forum. So in this role and in other roles, Sharon has had major influential impact at a national policy level, also European and international policy level, and has a real passion for drawing policy and practice together. And that passion is very much underpinned by putting the person at the heart of every innovation and every change that she's been part of. Her achievements were recognised in 2016 when she was awarded a CBE at the Queen's Honours, and that was for her services for nursing and also for the not-for-profit sector as well. But today she joins us from Scarborough, not Scarborough on the East Coast, which is the one that I know, but actually Scarborough in Queensland, where she works as the Executive Director at Ballycare. And I think we're going to hear more about Ballycare and learn more about what it is as an organisation and what they hope to achieve. But the whole underpinning philosophy of that is around facilitating positive ageing. So I'm really excited to hear more, Sharon. We will listen to your presentation. We'll ask you some questions. We've got about half an hour for presentations, half an hour for discussion and questions. So if there's anything from the audience that you want to ask, please do pop it in the chat box, but we'll open up to questions at the end of the presentation. So over to you, Sharon.
Thank you so much, Gemma, and hello, Julie, and others that might join us. It's a real privilege to join from the other side of the world. It feels a little bit surreal, and thank you for the warmth of your introduction. In the time that we've got together, I'm not going to be able to cover every avenue and aspect of how to lead change, but hopefully we'll look at some of the things that are happening both in the UK and some of the contrasts that are taking place over here and based on that experience. I work for an organisation called Ballycara, and as you see on the slide, the tagline is inspiring healthy and happy living. We've just finished a strategic review and we're going to go live with our next 5 year strategic approach. And that inspiring healthy and happy living, which has been our tagline, becomes our why, becomes our purpose in our new strategy going forward. And we achieve it through our impact in our relationships with people who use our services, their family, our staff, with our partners, but also with our presence and the way we do that in terms of our influence and our sharing that knowledge much wider. So Ballycara provides services for older Australians. We have a retirement village. We also do residential aged care, nursing care. We have home care, and we do that across 6 different locations, including outside of Queensland into Victoria in Melbourne. And we also have a full wellness suite, and we take a wellness offer to people across the other areas as well, very much focusing on a coaching and a wellness approach and living life to the full and helping people to be the best version of themselves. So that's a little bit about Ballycara and a bit about the organisation where I work. Can I have the next slide, Adam, please? So I think in order to address the question, we need to, and to lead change, you need to understand the context of where that change needs to take place. And I think for people who don't necessarily work in social care, they don't always understand what social care is about, and it always feels like there's this NHS versus social care. But social care is 70 years old, so it's the same as the NHS. You've got the slide in front of you. It's very poorly understood by people unless they have need to use it or are working within the context of social care. And it's delivered in a whole variety of settings with a wide range of organisations, professionals, their families and communities. And I think the strength of social care, and it's interesting because I'm sure NHS would say this loud and clear as well, is that we put people at the centre, people first, and really understand what matters to that person. I am going to say something that I think people would expect me to say. I think that we do it really well in social care, and I think we do it well across the globe in terms of particularly in aged care services. I think that what we do in aged care is very understated, and the fact that it comes under the umbrella of social care sometimes gets lost in translation. Can I have the next slide, please? So, did you know that many people are surprised to learn that social care is not free at the point of use in the way that the NHS is? And obviously that's paid through taxation. And adult social care is part of a complex system of services and support, which includes the NHS. And I think until people have actually used social care or had need to see it as a system, people don't necessarily understand the complexity of it and make judgments about what happens in social care without really having a full understanding of what it can achieve, and that it sits there to complement, not to overtake, not to consume, but to work alongside other areas, but more importantly to work with the person and help them make their decisions about the life that they want to live. Next slide, please. So I think to put some context and some legislation around this, excuse me if you hear me rustling my papers, the Care Act 2014 describes the core purpose of adult care, and its support is to help people achieve the outcomes that matter to them in their life. And for us as nurses, you can think, well, what does that really mean? What are outcomes? And over many years, I've become, and people may have heard me speak, I get very frustrated when people talk about outputs and outcomes as if they're one and the same thing. And I think along certainly my nursing journey, both outside of social care and within social care, often outcomes are described as if, well, once the clinician or the professional has done their job, that's what's seen as an outcome. And I would strongly disagree with that. I think often what we do as professionals is achieve the output, and the outcome is really what matters to the individual, how they felt about it, how they experienced it, has it improved their life. I think people who use social care expect clinicians to do what clinicians do, medics to do what medics do, and whether it's allied health professions, whoever that person is, they expect them to perform their role to the best of their ability, using their skills, knowledge and education to be the best they can be on their behalf. But actually, the outcome is, well, what difference did that make to that individual? How did they experience the care? And I think sometimes health is in the NHS and other health settings, sometimes it's about, well, you know, we've fixed the wound, we've made you better, therefore job done. And that's fine in an acute setting, but we work in a setting where relationships are really critical, and where it's ongoing and there is a real duration to that. So getting to know the person, how they want to live their life. And many of them, many older people particularly, or people with an intellectual or a physical disability, may face many complex challenges from a health perspective, but that isn't the dominant feature. They're still, those things need to be taken care of in the context of the life that they want to live. So moving on, if we can have the next slide, please. So I've put this picture up, And I think perceptions are really important when we talk about social care, because and when we want to talk about leading change. And I wonder, I'm not going to ask for any answers, and we can have a discussion at the end, but what do you see in this picture? Just take a moment to look at it. And I think there are so many things it can tell us, but there are some probably obvious ones and perhaps not so obvious ones. Can I have the next slide, please, Adam? And again, what do you see? Now, if I told you that over here in Queensland, where I live in Australia, I have never seen as many active older people ever. And it's not because they're all healthy or that they don't have any long-term conditions, but their approach to life is just so inspiring. It's inspiring to me as somebody who is entering a different stage of my life and getting closer to the latter years. And it's inspiring that people do so much. And when I look at our wellness centre, when I go into our gym at work and see people utilising equipment, making themselves available, our exercise physiologists who are a recognised registered professional over here, it's fascinating. We have walking netball, obviously like UK we have walking rugby. There is just so much geared around later life and opportunities for people to participate and be as healthy as they choose to be. Can I have the next slide, please? So the Local Government Association in the UK also talks about everyone being able to live the life they want to lead, to connect to what makes us feel alive and valued and to feel human. And that social care is about supporting people to achieve this, irrespective of age or disability may get in the way. It talks about community and when needed to enable all adults of all ages to do what helps them grow and sustain their well-being. And I think when we're talking about change and being an effective change maker, I think it's really important, particularly in a time when social care isn't understood. And I have to say that the world over, here in Australia, we've just had a Royal Commission into aged care. It started 2 years ago when I arrived in Australia. It's just concluded. The government have just delivered on it, which is amazing, because we had a Royal Commission in the UK, along with about 20 to 30 other reports over as many years. And our government in the UK still hasn't really taken any proactive stance on social care, because they keep putting it in the too difficult box. And whilst over here in Australia, from my perspective, I think they're a little bit behind some other countries. That isn't to say that we've got everything sorted in the UK, but my experience to date is that there are things that Australia could learn from other organisations and other countries. But the government has responded both financially and quite robustly to the Royal Commission into aged care here. And so there's a whole tranche of activities that now will follow. One thing that they haven't quite grasped, which I think in the UK has happened, is that a person using the service in the UK does get a voice at the table. And in social care and in social care policy, it's very rare that there isn't somebody with lived experience or a carer of somebody with lived experience at the table contributing to policy formation and making sure that it translates into practice. We've got in Australia, there are organisations that really represent senior Australians well. However, older people themselves don't always have the voice at the table. So when we talk about change, my challenge over here at the moment, and in the spheres that I move in and the groups that I'm part of, that's my constant, it's my stuck record at the moment is, okay, where's the person with lived experience? Can we get them to the table, please? And how do we turn and look through a different lens? So in some ways, and if people have heard me speak before, there's a lot of synergy with that in the UK, because multiple tables that I had the privilege of sitting at in the UK through my previous role, I would always talk about the person using the service. I didn't use the word patient because I think it puts people into a different mindset, but because we're all people who use services. So I think if you want to bring about any change and have your voice heard, I think it's really important, whether you're working in health or whether you're working in the social care sector in its broadest sense, really understand the context. And that's the same in the other way. You know, I used to have to ask my colleagues when I was sitting at a table in the UK around the NHS. I hadn't worked for the NHS for many years, and obviously it had changed and was evolving and changing. So I needed to also respect what was happening for my colleagues and ask them about their context so that I understood and I didn't make assumptions, because making change from a false base and a base that is not solid and is full of assumptions actually isn't going to lead to change at all, and it can do a lot of damage along the way. So it's really important to understand the context. Can I have the next slide, please? So there's a really good movement taking place in the UK at the moment, and if you look on Twitter or anywhere, it's called #SocialCareFuture. But they've been doing some surveys, they've been gathering momentum. They're a group of people that really want to influence policy and the shape of social care in the future. They are made up of a whole range of both professionals and people who use services. And again, across the whole adult spectrum, so people living with a disability or an older person, and you know, and everything in between. But they've said, don't we all want to live in the place we call home, with the people and things that we love, in communities where we look out for one another, doing the things that matter to us? And you might say, well, yes, we all do. But what does that have to do with nursing? What does that have to do with health? But you do that, and health shouldn't be the main determinant. Not everybody is, you know, needs a clinical or a medical model. We need a model that helps us live our best lives, in which health and medicine and other allied health professionals come in and out of our lives at any given point, that support us and enable us to do the best that we can do. And nurses, dare I say, aren't always the best person to deliver the outcome. And I think there's something in our discipline as nurses where we need to really value the expertise of the team. If you've ever had the benefit of really, truly working in a multidisciplinary team, you recognise how you complement each other and the skills you bring to the table for the benefit of the individual. So it's not about competing. I always get a bit exasperated when I see, especially some of the Twitter conversations that take place and other things where it feels like we're vying for position. And that isn't to say that nurses shouldn't have a voice. Nurses should have a voice at the table. But I think to do that, nurses also need to grasp that they need to become a bit more political and also understand the law a little bit more and an evidence base. It's not just having about a good, strong clinical base, an underpinning of knowledge and skills, but it's also to that wider context about how we function as society, how we function as communities, what motivates and drives us, remembering all the time that we ourselves are these people who use services. We ourselves could be patients at any time. I've used the dreaded P word. Can we progress, please, Adam? So there's quite a few things on the next slide, but the Social Care Future, they want to promote a news story. They want to inspire and get the debate going. They want to underpin this story with real examples of the approaches that really showcase the future and working with others to grow and spread them, recognising that it can't be done in isolation. They want to challenge and change the present through action at all levels and to close the gaps that exist and to really ground people in reality and develop practical solutions that take us forward into that vision, navigated by people with that lived experience and where the insights come from. And it's building that social movement for change And a few years ago, I was privileged to be part of another social movement that's called My Home Life. And people will be familiar with Professor Julia Mayer and the work that she has led with her team. And it was underpinned by relationship-centered care to deliver person-centered outcomes. But it really recognised, it raised the voice of people and living and working and visiting care homes. But now it's expanded to so much more and into neighbourhoods, into communities. But it's got a real solid evidence base, and it got people talking around care homes, particularly in a very different way, and understanding the intricacies of relationship. So change, when it happens, needs to change when it happens. You need to know what it is you want to change. You need to know what it is that you can contribute. You can take a scattergun approach, but actually then expect that you may have little impact. So what is it that you really believe that you can impact? And I suppose for me, as Gemma mentioned in the introduction, for me, a lot of the things around the language we use, because I think language drives behaviours. I think it's about understanding the context and understanding what things are within your control and what things are outside of your control. And that doesn't mean you can't edge them, that you can't nudge, that you can't inform and can't challenge. But it's also about managing your own expectations and understanding your skill and expertise that you bring to the table and the voice that you're going to lend. And I'd say don't give up. I think when Gemma and I were discussing earlier is that prior to doing my scholarship, I got to a point where I felt that I was really like a stuck record. You know, I'd been saying the similar thing for many years in as many different ways as I could. And I just thought, you know, how long can I go on doing this? Don't people get it? And I realized that people didn't get it because people didn't know. And so one of the learnings for me that came out of my scholarship was very much about understanding how to repackage my message, how to repackage myself, but also to have maximum impact, and sometimes less was more. And that it was okay to say the same thing, because there's also something about timing of the message, timing for when people are ready to receive. Sometimes we're ahead of our times. Sometimes we haven't caught up. But it's understanding all those nuances and what's to play for, and finding out where can you fit in and slot in, and not concede. Don't change, don't give up on the belief, but just to really contribute and to be able to really bring your message to the table. Thank you. So I wonder, again, I'm going to get you to pause. We had a pause earlier with the other pictures, but I wonder how you define living. And it's certainly a question that we ask ourselves where I work now. And, you know, how much of a risk taker are you? What is the cost of that risk? Cost to you personally or to the organisation where you work? Obviously, sometimes we do work within parameters. We work for organisations, and we can't just go off and be totally rogue. But how do you define living, and how does that inform how you contribute, how you manage, how you lead, how you implement change, how you ask questions, how you inquire, how you support? So do go on, Adam. Go on to the next one. So where do you start? You start with yourself, and it's important that you understand your narrative. And I had the privilege today, we do an annual intergenerational public speaking competition with our schools at sort of years 11 and 12, which are the sort of top years at senior school. And they are set a question and they are judged, and it was amazing. But they all spoke about dreaming and being ambitious. And I would say that, you know, I looked at them and I thought, you're our change makers of the future, and you need to be bold and you need to dare to believe the impossible. And when I started out sitting many years ago at the Department of Health, and I used to feel like the token social care representative, and I would say my piece or make my contribution, and it was like, well, they're their dear. Sometimes it felt very odd and surreal, but actually I never lost sight of the fact that somebody needed to be at the table. And now when I look around, there are so many other voices in so many different places and in so many different disciplines. And when I look at the work that Professor Adam Gordon's doing and others, geriatricians working through the research arm, and with many nurse professionals in the care home zone particularly, it's wonderful because people are changing the narrative, and it's not necessarily top down, but it's from a lived reality of people getting alongside each other. When I, of working alongside each other, taking time to understand each other. When I think of, and I'm going to get the name of this wrong, which it's wrong of me because I haven't written it down, so forgive me, but there was that whole change program from the NHS around care homes and health, and there was a whole radical change program, and there were some really good initiatives that came out of it. I'm going to kick myself that I'm sitting here and I can't remember it, so do forgive me, but it was fantastic, and there were some really key people in that who just took time to understand the sector and to also be understood, and understood what the vision was, understood the narrative, understood the language. And it's really important that sometimes words are used and they have different meanings in different sectors. So it is important to agree and clarify and have shared values and a common ground. Can you move on, please, Adam? And then just continuing, understand what the change is and what it isn't, and know your why. And more recently, especially when leading our strategic process over here, I've always used the 5 W's and the how, because I think it might be really simple and really basic, but it really helps you get to the core of what you're doing. Reformed approach and finances, you will have to do things differently. Sometimes you will have to do more with less, but that's still achievable. But you have to reform and adjust. Co-production, going back to where I started and what Gemma said in the introduction, is really key. In co-production, isn't just about collaboration, it's true co-production, side by side, people with lived experience and professionals and others working to lead change in social care, because that can impact society and the wider system. Social care is good for people, it's good for society, and it is good for the economy. And I think people underestimate the value that it brings to the economy. So before we go away, I'm going to just ask some sort of questions before I come to my last slide. But Mark Twain says the 2 most important days of your life are the day you are born and the day when you figure out your why. And I would ask you, are you committed to a strategy and formally setting in motion a sense of purpose that goes beyond any profit or surplus? But is there a cause? Do you know the why of what you're doing? Because if you're going to lead change, you do need to understand your why and how that marries with the why of the change that needs to be implemented. I would ask, are you part of something that's bigger than yourself, setting out benefit to all communities and people that you contact with? What's the difference that you're going to leave through each interaction that you make? What's the impression you're going to leave on somebody's life, on a room of people, on a group of people? What impression will I leave with you now, and when this goes out more widely? And it's really important to think about change being that ripple effect. We talk about change management, and sometimes there are specific things that need to be done, but when you're leading a change of a system, it is incremental, and you have to just keep on having those conversations. So my repetitive conversation over here is, can you not put it in the too difficult box? That involving people with lived experience is, isn't a good idea. We talk about it, it's in our policy over here in Australia, but doing it feels too difficult for people. How do we do it, and how do we do it well? And to do it, you will go through some pain. You will, but to go through the pain, you will get the gain. So that's really, really important. Do you pioneer positive changes within your sphere of influence? And meaningful change requires a great deal of hard paddling under the surface. It demands rigor and determination. And to do that, we must see the change we seek in the world. So we have a responsibility. Don't let anybody say, oh, they have to change. We're all very good at pointing the finger, but there's three pointing back at us. And it's really important to understand our responsibility, our accountability in being part of the change. Do you truly believe and behave as if people and place matter? Because if you do, that's a really good starting point to leading the change and having a place to land your ideas and to work with groups of people that you can influence, not coerce, just influence and have a really informed conversation. Through all you do you aspire to benefit all? And people would say, well, I'm a nurse, that's what I do. But no, really think about it, because it's these smaller things, the things that happen within each one of us and come out of us, that will affect the change, the way we behave, the way we speak, the way we influence. Those are the change. We can make changes. We can manage change management programs, but actually real change has to be lived through each one of us. And to do that requires that we act with the understanding that we're each dependent upon another and thus responsible for each other and future generations. So in effecting this change that we want to bring about, whether it's at systemic level or local level and up close and personal, we're not going to do it alone. We are dependent upon each other, but we also have a responsibility as well. So Adam, can I ask you to go to the last slide, please? So nearly the last slide. So change, navigating it, we want change as an epidemic. It needs to positively spread. And that's best achieved from the middle out, in my experience. It's also about you living, breathing, walking, talking, influencing, just oozing and living out what that change is and understanding the context across the very different organisations that you will come into contact with. Don't make assumptions, please. That's really important. We have to have a learning culture, not a blame culture, and that will lead to a learning organisation. Understanding how we can always improve. Sure, sometimes things need to be called out, but actually it's cultivating that learning culture. Always evaluate what you're doing. You'll never arrive, and if you think you've arrived, well, then you've still got some more to come. You've still got a distance to go. Guide people, really communicate and cooperate. Really operate from a place and a base of integrity and truthfulness, and equip and empower others. Real change comes about when you're enabling each person to be the best version of themselves. Can I have the next slide, please? And this will be my last slide. There is a resource slide that Adam will probably share with you. But I want to say to you, you need to be the change you want to see. It's all really well and good to say they should change, they should do this, they should do that. But actually, what are you doing? And Socrates said the secret of change is to focus all your energy, not on fighting the old, but on building the new. I hope that there's sufficient there to stimulate, to inform, and to have a conversation. So I'm going to hand back to Gemma. Thank you for your time, everyone.
Wow, thank you so much, Sharon. Gosh, my pen's got fire coming off it. I've been writing down so much of what you said. Thank goodness we've recorded this, because they're just absolute nuggets there that we need to reflect more upon and think more upon and share. So thank you so much, Sharon. Should we stop sharing our screen now and then we could have a bit of a conversation?
Yeah.
That's brilliant. Thank you, Adam. So we have Julie and Teresa here. You're very welcome to pop your cameras on and join in the conversation, both of you, or alternatively, feel free to pop any questions in the chat and I can put them to Sharon. I know sometimes people are calling in from clinical areas and it's not easy to interact. So I'll kick us off, and I'll keep an eye to see if others have got questions coming forward. So Sharon, you spoke quite early on in your presentation around the difference in the social constructs of ageing that you're seeing when you compare the UK to your experience in Australia. What's your reflections on what's underpinning that? What sustains the way that we see older adults?
I think in the UK, and I can only say this now, I think because I'm not there, I don't know if I fully appreciate it, but I think we're really ageist. I think we, I say age is just a number, but actually it's almost, there's a trajectory that when you get to certain ages, well, that's what you expect, isn't it? And you will behave this way. So that it feels like there's a conditioning. Whereas over here, there's a real focus on living. Now, that doesn't mean that people don't have multiple comorbidities, that they don't have constraints, but it isn't what defines them. And it doesn't seem to pose the same limits. Yes, there's still different social groups within society. There's different areas where you get higher areas of deprivation, and therefore I haven't done any studies or I haven't really looked at that closely to see how that would compare with the UK. But even in spite of that, people are just more active. And I think that they talk about senior Australians. They don't talk about old people so much. There's a whole language shift. So I think all of those things, they inform and shape your thinking. Your thinking informs your behaviour, and from your behaviour there is consequences. The ABC, what's the antecedent, what's the behaviour, and what's the consequence?
And how do you notice that influences how services are delivered, how healthcare professionals respond to the senior Australians?
I think I can only refer, I suppose, and reflect on my personal experience in the organisation that I've joined. I said earlier that we have allied health professionals. One of the allied health professionals over here is called an exercise physiologist. It's a degree course, 4 years. They are a registered professional, and they're very different to a physiotherapist, although there is some crossover. But whereas a physiotherapist is very much treating somebody for a condition, and for a set period of time, exercise physiologists are much more about that health and well-being, and take a much more coaching. So in our organisation, we employ a number of exercise physiologists. They serve as coaches. And one of the programmes, it's not widely spread out. The whole funding system over here is very different to the UK for social care. Capacity in the sector is controlled by government, so the number of places. So somebody doesn't, when they want to put more places, people can tender for those places to run services, or a new service can crop up. But so it isn't like just, today I'll decide to open a home care business. It doesn't quite operate like that. But within those programs, there's a particular program called short-term restorative care. And it's an 8-week funded program, purely where a team of people, and we lead it with our exercise physiologists, but there's nurses involved, physios, counsellors, we have OTs involved, but we coordinate those services. So there is a multidisciplinary approach, but through that short-term restorative care program, somebody may be at home, and our approach is very much one of coaching, and they may say, it isn't about, oh, you've got to lose weight, or you've got to build muscle in your legs. We sort of don't use that sort of language. We'll say to people, what is it that you want to achieve? What outcome? What's meaningful to you? And they'll talk about, well, I want to be able to stand and make a cup of tea again. I haven't been able to do that for a while. I'd like to stand and cook dinner. I'd like to walk into my garden. And so everything that they're doing are strength-based, in, you know, exercises. They are stuff that will enable them to do that. But because it's oriented about what matters to them, it's focusing on their outcomes that they want to achieve. It just makes the whole exercise component doesn't feel like exercise, because they're going to do their cup of tea. So there's a whole shift in focus, language, and I know that seems really minor and really basic, but when you extrapolate that on multiple levels and take that sort of approach to living, it really has an impact across society.
Well, absolutely. It makes me think about how you tap into that person's internal motivation rather than you defining the outcome for that person. You work out what it is that's actually going to be, as you said, meaningful to them. And that's where the motivation is to engage. Fantastic. Thank you, Sharon. And you've spoken a few times throughout your presentation about language. I'm a mental health nurse and have similar challenges, debates, disagreements about how influential and powerful language can be. And I just wondered if you could comment more, reflect more on why you see language and the terminology we use to describe people and the narrative, as you described it, as so influential.
I think sometimes, you know, from a very young age, how we're spoken to, how we're spoken about shapes and informs who we are as a person. But it's more than that, it also can shape and inform how other people perceive us and receive us. And I think, I'm sure we've all can think of stories or from personal experience. I'm not going to try and get too deep here, but or we've observed where, you know, somebody's been told they're no good or they won't amount to much. And when you're told that often enough and in a negative way, it sinks in and you begin to believe it, and then it becomes that internal narrative. And so it becomes your mantra. You believe it, you adopt it, you begin to walk it and live it. And I think if, you know, it takes quite a bit of work, or, you know, we've all seen that special teacher that has worked with a young person and managed to elicit and find that that diamond and, you know, make it shine as such, make that person shine. So I think it starts really at an early age, but I think when we get into adulthood and also later life, how we flippantly sometimes use language and describe people can still, even when we've reached adulthood, influence and place limitations on us. So, and especially in the world, I'm trying to think of some examples. There's a really good example. I had a conversation with somebody today. Over here, our funding system for a care home place with nursing, the model is, even though our standards talk about promoting, giving voice, choice and control to the individual, actually the model, you have to identify all the deficits. So on a daily basis, because everything you do is linked to this funding instrument, the staff have to capture everything a person cannot do. And yet we're also saying to our staff, but actually we want you to help them live their best life and be the best version and be positive and do all these positive things. So staff are in a real quandary. And one of the dilemmas on that is people over here talk about behaviours, and it's all about managing the behaviours. I hate it, just as I hated in the UK the term challenging behaviour for a person living with dementia. Because a person living with dementia may exhibit behaviours that may challenge other people, but for them, they're trying to tell you something. And it's really important to understand who that person is get to understand their history, so that if they're not able to communicate, you can try and, with their family or significant others, and knowing their history, try and understand what it is, because it's only challenging to me. They're not saying I'm deliberately, intentionally going to challenge you today, and yet we've taken that term in the UK and we say no, it's a behaviour that can challenge, and it's not. I don't think it's plain semantics. I think it's really important, because if you're in handover or you're with a group of your staff and you're talking about somebody behaviour sometimes challenges us, or they're exhibiting challenging behaviour, that causes a reaction in the individual. And it's much easier to think, oh, they may present with a behaviour that may challenge me, I need to learn how to manage it in that. Whereas if you say, oh, they've got challenging behaviour, you're immediately in that zone that says, oh, I have to be wary. And actually I might be quite scared because they may be quite violent. And I think those subtleties happen without us realising them, but I think we have a duty to have an awareness about how our language influences things. Some years ago I was involved in a piece of work and across the 4 nations, and during the process I broke my arm, and when I went to hospital, I'd actually tripped up on the pavement in the street and landed and broken my arm, but I was sent to see the fragility nurse. Now, as somebody in my 50s, I did not want to see the fragility nurse. I found it quite offensive. Now, she was lovely and she did her job beautifully, but I just thought, how does somebody get that term and that language, and what does it say about me? I felt like I'd suddenly aged years, and even all the questions was much more leaning towards somebody that was significantly older than me. It was almost, well, what were you doing falling over? It was just a really odd scenario. But I think it's just something that needs to be challenged.
Thank you, Sharon. And Julie's popped in the chat box that she agrees with your points around how language is so influential, and that's something that at her own place of work they're really adopting a drive towards more positive language. I completely chime. There's so much of what you say there, particularly in your presentation. You were saying about we are all people who access and use services at various different points in our life. There isn't a them and us. There isn't a patient and a professional. This is about communities, and it's so central, isn't it?
Very much so. I think it's really important that usually, I haven't done it today, but I'll share with you, often if I do a talk and I know that I haven't been in front of the audience before, I'll often ask people if they're willing to raise their hand if they took medication that morning. And it's surprising how many people, I for one, would put my hand up. And then I'd say to people, you don't have to put your hand up now, but how many people here care for somebody, that you have somebody dependent upon you? And it's interesting, so often people will feel safe enough to put up their hand, but and then the third question is, I wonder how many people have a long-term condition themselves, and how would they feel? So firstly, those 3 questions usually determine that it's not about them, it's about us.
Yeah.
And then certainly that last question, if somebody's had a long-term condition, they probably know more about it because they know more about themselves and their reactions and how stable or unstable, how predictable and unpredictable they are in terms of the management of that condition. And working with the professional will bring much better outcomes, but often the professionals will try to take over. So I think it's just bringing it up close and personal sometimes.
Yeah, absolutely. And just as a final question, Sharon, I've heard throughout your answers to your questions throughout the presentation, the strong values and philosophy that underpin your work. It feels like, without asking you, I know your why, because it obviously is just totally threads through everything that you speak about and what you do. But I wonder, how you became so grounded in that why. What was it that enabled you to feel that sense of purpose? And obviously it's been a thread that's ran throughout a long-term career in this setting.
I believe in people's rights, and I believe that we're all, in terms of health, I think there's something about we're all equal. We should all be able to access that. I think all people should be given a voice, whatever that voice is, and however that voice is expressed, whether it's written through a machine or, you know, speaking as you and I speak. And I think people need to be heard. And I suppose, you know, life shapes us as well. And so we all carry personal experience. And I think our personal experiences shape us. I suppose there are personal experiences that I've had where, without going too deep, you can choose sometimes to be a victim or a victor. And I have a strong faith, and that underpins who I am. I'm a Christian, and I make no bones about that. And that also gives me, personally, I wouldn't impose that on other people, but if you've asked me a question, and so that gives me a strong foundation, and it's one about inclusivity. And I think just thinking sometimes, stopping to think about what we ask people, what we're trying to do for people. And it's not what's the matter. And I know that there's that whole movement from America, but not what's the matter, it's what matters to you. And what motivates me is what matters to the person. I've wanted to make a difference since the day I became a nurse. And I still want to make a difference to the life of an individual and their family. And although I'm removed, I'm actually, do I confess on here that I'm now retired from the NMC register, and I didn't transfer any registration over here. But yes, that's what motivated me every day. And even though I'm in a senior executive position now, I still get up wanting to make a difference to the lives of the people that we have the privilege of working with. I do that in a different way to the frontline staff, but without our frontline staff, I couldn't do my job. So I don't know if that answers. I think there's a multiple things there.
Absolutely. Thank you so much.
You're welcome.
Really do appreciate everything that you shared today. Gosh, I think the significance of that underpinning message that you've offered and challenged us all to think and reflect around, it's going to play on my mind into the day and into the evening, and thinking about what's my why. Absolutely. So thank you to Teresa and Julia. I appreciate, Teresa, it's tricky to interact when people are calling in from work, but thank you for joining us. And we will be sharing the slides. We will be popping this recording on our YouTube channel so that many others can benefit from that real wisdom as Sharon shared with us today. So thank you all, and we'll say goodbye for now.